Hmm. শুরু করুন। হ্যাঁ। Good evening. After a long time, I am here with you, going to share the advanced idea regarding potency, which is completely new. After seminar, I have decided to share my knowledge through slides. In this case, also, there is no exception. There are few slides for presenting a subject. And I have prepared in this way that someone will understand easily. Yes, one thing is very right. When I will tell you, it seems very easy. But when you will give exam in front of your patient, it's really a difficult one. But one thing is very right, that at first, if you feel difficulty, then it is difficult to understand. When you feel yes, it may be easy, then it will be easy for you for learning. Considering this idea, I have made all the chapter in slides, through slides. Let me give 1 minute for finding out how many slides are there.
Sir, have you started the class?
Yes.
Okay,
I'm
good.
going to.
Okay,
Please wait.
okay,
1
sure.
minute.
Sure.
No, slightly F, G, F, G. Sorry for the delay, as because today I had OPD duty after 1 month. So there was gathering and I have come late here. That is why all the slides are not ready. Now I am in a position to share my knowledge. First slide, there are A, B, C, D, E, F. 6 slides are here to make you understand regarding this one. I will tell you one by one. To make easy the difficult one. First, origin of the idea. Which idea? Oh, I think screen is visible, is it not? Please tell the screen is visible or not?
দেখা যাচ্ছে স্যার।
Oh, fine.
Visible, sir, visible.
Visual, yeah. Thanks. So,
Visible.
yes, thanks. This idea regarding potency, according to my knowledge, it is the latest invention and the easiest one, with which more than 90% cases, the follower of real homeopathy, they are successful enough. Many more cases are there when 65 doses is not enough for better result. higher potencies are needed. That is, which I discussed in Diga seminar. Every day, next higher potency. And when this idea was started, which idea? The idea regarding every day next higher potency. So many patients are there. They are unable to tolerate the everyday next higher potency. Every day next higher potency. So I was in search of the easiest one, the fruitful one. It was there in my idea. What to do? You see, here I have written. After use of different higher potencies, every day next higher potency, different adverse situations were observed in different individuals. To overcome after effect of higher potencies, lower potency like 200C, lower potency like 200C potency was administered and the situation was better. Next, with 0/3, the condition was far better, and likewise 0/2, 0/1 were used, and the situation was better. Were used and the situation was under control. This was the idea behind 65 doses or potencies. Actually, one thing everybody you know very well than me, that is, necessity is the mother of invention. So many a times when I was in a critical condition with different critical cases, that time the new ideas came in my mind. Even till today, I am thinking one after one, the new one, which I am going to share today in today's seminar. I must tell you the previous one and also the newest one. I will tell you which part is this. You know this part? We start treatment first 5 days, high division CM, high division 200, next day 03, 02, 01. But I have told you my latest experience that after CM, a new case, a madam, teacher of high school, I think, CM was given first day, and she told me she is feeling better in all respect. So according to the previous rule, 200 was advised, and after 200, she told, yes, sir, I am better, but not like yesterday. I told, please proceed with 0/3. And after taking 0/3, She told me, sir, I am not in a good position. Please tell me what to do. See, it is a new case. And I have told you many more times you have to use these 65 doses even in different round. But see, in this case, no scope for proceedings with the first round even. So as I give every patient all different potencies, like in the first packet, 65 doses. In the second packet, from 15 to 27. In third packet, 30 to 45. Fourth packet, 48 to 60. And fifth packet, 500 to 50 M. That means 50,000. So all the packets were given to a patient. That's because I always take money for the whole course and I am bound to give all the medicines. So I told her, please take it, that very hydropovinum 0/15. And the situation was under control within a few minutes. You think if it was not there, that means that potential are not there, that very patient would leave me. Considering this homeopathy is useless. Only 2 potency, only 2 days, they are a very good situation. So nothing can be expected from a homeopathic physician. That is why I have decided for all the followers, all of my followers, to give minimum 2 packet living, 2 type of potencies. If you give hydropovinum, then hydropovinum CM 200, 3 to 1. And associated with this, putting cross mark, you have to give 0/15, 18, 21, 24, 27, like this. On the other hand, if the patient is old one, that means you may consider the patient is coming to you for 3 months or more than 3 months. In that case, you have to, if it is needed, you have to start 0/15, next 0/18, next 0/21, 0/24, 0/27. Associated with this, putting cross mark, the hydropovinum CM 200, 03, 02, 01. Why? If the higher potency is unbearable, higher potencies are unbearable for that very old patient, then you can advise the patient for taking the lower one. That means to neutralize the after effect of higher potency, the lower potency will help the suffering individual a lot. So minimum 2 type of potencies you have to give. May it be new one, may it be old one. I think this part is clear to you. If it is not, I will discuss in the class. And this part also, in the first slide, this part also, in the first slide, under first slide, the medicine of second cycle. You know very well, I have told you many more times, but today, one of my student asked me, sir, what will be its medicine of second cycle? Instantly, I told her, then you go to the road, no need to learn this one. So, I have told you many more times, more than 99% of world population belongs to the negative category, and medicine of second cycle is sibylinum. And less than 1% case, there will be negative Drosera, there will be negative hydropovinum. But you should not tell, sir, forget all these things. We will treat only sibylinum. If they come, negative Drosera, negative hydropovinum, we will not give any importance to them, but it should not. They are there in the world population. They are very hopeful for treating with you. So you have to know everything. In this regard, I want to tell you, who is Siblinam? Siblinam is that very individual who is having changed philosophical aspects. Changed philosophical aspect means today is worse, yesterday was bad, yesterday was worse, today is bad, and tomorrow will be good. This type of changing philosophical aspects indicate sibylinum for the medicine of second cycle. Now, for the selection of Drosera, no, first sibylinum, second negative hydropovinum. In case of negative hydropovinum or hydropovinum, there is no scope for changing of philosophical aspects. Which was yesterday, same thing is today, same thing will remain in tomorrow. So unchanged philosophical aspects are for hydrophobia. During treatment of convict in different jail, this idea I have confirmed many more times. So I am confident enough. Where there is changed philosophy, sibylinum. Where there is unchanged philosophy, hydrophobia. But you have to use your intellectuality. If you think a little, it will be very easy for taking a decision regarding sibylinum and hydrophobinum. Now, what about Drosera? You will get Drosera very less among world population. But you may get, you will get, you must get maybe 0.1%. But they are there. For taking decision regarding Drosera, the one thing is very right. But there is also chance of wrong selection. you will see many more times that your patient is telling, yes, sir, yes, madam, I was very interested for traveling previously. Now also, I know in this case you will select Drosera for the medicine of second cycle. But before taking correct decision, you have to ask one more thing that will clear your idea. Which one? You have to ask. Suppose you are given one
Madam,
lakh. Please
namaste.
don't disturb. Please, please. Dana, if you are given 2 lakhs rupees, how you want to utilize it? What you will do? Please tell me. More than 99.99% will tell, I first make my saving. Or someone will tell, I will buy so many things for my family, for me. Less than 0.001% will tell, yes, sir, I will go out for traveling, and the rest part of the money I will save. Or rest part of the money I will distribute among the needy fellows. So your decision will be correct. Otherwise, I was the wandering was very pleasurable item. With this, you can't take any decision regarding Drosera. Drosera is very least interested for savings. They never think about it. They always think how I can help the needy fellows. Yes, you may tell, sir, during earlier life, the person will was having the idea of traveling, wandering. You may say, yes, he was very immature, unexperienced enough. So you have told the philosophy of earliest part of life is needed. So it was there. But see one thing. Those who are interested for traveling, you may put it one side of the coin. But another side of the coin is that very individual want to share his property among needy fellows. And then only you can take the decision regarding the medicine of second cycle as Drosera. So this simplest idea, I think, you will never forget. First one, tense philosophy, the Sibylinum, and tense philosophy, the Hydrophobinum, and the wandering amelioration or sharing property with needy fellows, the Drosera. All these things I have told you many more times. But as I want to proceed from beginning, that is why I am telling all these things. Till now, I have not reach that very newer one. Do you feel any difficulty as I am talking in English? If you feel, you may tell, and I will try my level best in other language. Other means Bengali or Hindi. If you feel the need of that. So, in general, when the system will feel that when the system of the individual will feel no more change, after certain change, now there is no more change with hydrophobinum, different potency like CM 200, 03, 02, 01. No more change are observing. No more changes are observed in an individual. Mind it, but not the worst condition. Yes, it was very worse, but after taking medicine, hydrophobinum different potency, now patient is feeling better. But that very better, you may say the patient is now 60% better. But no more proceedings after 60%, no change after 60%. So 40% remain, of the suffering remain unchanged. That very time, you have to use Sorainam, considering the system is exhausted. So then you have to use Sorainam. And following the conception of 6 cycle, you have to go 4th cycle. So first cycle, hydrophobinum, catalysis is needed, Sorainam. Then second cycle, then Sorainam when catalysis is needed, and then 4th cycle. One thing I have to tell you that this is, I think it is little new. That is, what about 3rd cycle? 3rd cycle is a cycle for complete change, where there is complete change. Previously, I have told you the medicine of 3rd cycle is Siblinum, but it is not right. Actually, 3rd cycle means completely changed from earlier days to present day. Just now I have told you. Siblinum is having changed philosophy. Hydrophobinum is having unchanged philosophy. But one thing I have not told you, where there is complete change. Previously it was all the thing plus, now all the thing minus. Or all the thing plus, or now all the thing. Not like this, just complete change. For complete change, I can tell you the name, one name of Rishi Valmiki. Says Valmiki. Previously, he was Bandit Ratnakar. Complete change. So, Bandit Ratnakar, you have to consider in 3rd cycle. That means 3rd cycle is a cycle where there is complete change, complete. Not 90%, not 99%, not that. 100% change from negative to positive. It is in case of Bandit Ratnakar, who became says Valmiki. If you see in an individual there is complete change, so you have to take, you have to consider that very person under third cycle. Now, what will be the medicine for Bandit Ratnakar? You see, it is complete change. And there is the great talent for composing Ramayana, the great creation. So the medicine is Drasara. You may consider it negative Drasara. So in third cycle, I have told you, regarding Sibilinum. What you see, in case of Bandit Ratnakar, it is Drasara also. So it is here, the third cycle, we must consider it the complete change philosophical aspect is considered for third cycle. Now, in case of fourth cycle, it is there the same thing, CM 200 0300201. The curve animal is like this, CM 200 0300201. The catalysis, Soranum CM 200 0300201. And next, the fifth cycle, Drosera. If there is no history of tuberculosis, you may use it for the second cycle, or for the third cycle, or for the fifth cycle. But if there is a history of tuberculosis, you should never use Drosera rotundifolia for second, third, and fifth cycle. But you can use the Sibilinum as second medicine in the fifth cycle. Sibilinum CM 200 321, and next Soranum CM 200 321, and next is sixth cycle. Where the medicine either will be Thuja occidentalis or will be Mediterranean. It depends. Regarding this, I have mentioned in the second volume. I have written there. I have described it very clearly there, if you please. Now, either after Thuja or after Mediterranean, the second medicine will be either Medo or Thuja, and then catalysis. This is the first round of administration of 65 doses of real homeopathic medicine. If there is gradual improvement of pathological report associated with the nature of evacuation are observed with the 65 doses, second round should be started in the same way. Third round, fourth round, etc. may be applied. I have told you previously, to make you understand, I have made all the chapter in different cycle. In this case, that means the potency A, B, C, D, E, F. 6 cycles are there, 6 slides are there. This I have told you only first cycle. Second slide, B on potency. I think screen is visible. Latest procedure of admission of medicine in case of type 3A category. What I have told you just now, this idea is used for the this idea is used in case of treatment of type 3A category. At first, course of 65 doses or potencies at 24 hours interval. For first round, that is one dose within 24 hours. If there is no satisfactory result, after 65 doses, next 12 hours interval. It is here, you see, I have increased doses in different rounds, but last of all, I have decided one thing, that only single dose per day, either in first round or second round or third round or fourth round or fifth round. Because after use of more medicines, always doing bad for the suffering individual. That is why this idea is not applicable now. Then you will tell, sir, why you are showing all these things? Yes, you are right. But very few cases, it gives good result. But you should forget it. You have to mind it, only single dose for any cases, except accidental case. In accidental case or hyperpyrexia, there is also, it is 1 hour interval. So, you may mind it, but be careful for using more doses in case of type 3A. But when you will consider the case is type 3B, when more doses are needed during 24 hours, like accidental case, like hyperpyrexia, you can't wait. Where there is temperature is 105 degrees or 106 degrees, you should not wait for 24 hours. And patient will not wait for you, for your decision. So, in case of type 3B category, more doses will be needed, like accidental case. In that type of cases, you may use medicine even half an hour, even 1 hour interval. And in case of hyperpyrexia, you can use it even after 30 minutes interval. So different idea you should have. When it is needed, you have to use. So this is another slide. At the end of 6th round, the physician should compare all 6 pathological reports associated with nature of evacuation and have to find out after which cycle, which medicine, and after which potency, the situation, that is pathological report and nature of evacuation, were better. But now,
So that is not visible, sir.
oh my God.
Slide
Okay,
is slide to be changed.
Yeah. Sure. Oh, screen sharing is paused.
क्या हो गया सर?
Wait, little.
Okay, okay.
It is here. Now see. It is not visible, no?
No,
No. Okay.
you can talk about it. That's okay.
No, no. I will show.
ऊपर नंबर जो भेजेगा मतलब 5:45
दिखाना होता है कागज, वो तो कह रहा था बंदा।
ये जो कुछ करेंगे इसलिए प्रॉब्लम यार।
समझ गया, तो इसके अंदर सत्संग का टोक नहीं लगाया था, उसने बताया नहीं होगा। एक्चुअली उसका इंटरेस्ट नहीं था सत्संग, मुझे पता है। अभी जितनी
ये नहीं बैठने की चाहती, 2 घंटे बैठना नहीं चाहती।
हाँ बताओ। तो
उसमें लिखा हुआ है कि 2 घंटे बैठना।
उस चक्कर हमारे लिए भी नहीं, हमको भी नहीं। ठीक है,
क्या 15 मिनट मिल जाएंगे, बाबा जो देना वो।
हाँ हाँ, वो तो मस्ती ले जा रहे हैं।
नहीं करी मतलब
5:45 पे निकलना है ना हमको? हाँ,
45 में वहाँ पहुंचना है।
निकलने के थे, बताओ।
5:15 विश्व में निकला, 5 ही सोचे चलो।
5 जाना, 5 ही बेस्ट। तो जाओ,
फोन लगा दो, चार्ज तो कर ही दो।
Slide is here.
क्या चिल्लाए हो?
Slide এখানে।
पूछेगा चार्ज करने।
हाँ ठीक है, लगाओ, कर
করতে গেলে
दो।
slide আসছে না কেন?
हाँ, चार्ज कर लो।
अरे ये ना ग्लास में वो है, हाईटेक बनाया उन्होंने।
कौन सा ग्लास?
बाथरूम के ग्लास पे पावर स्विच है, लाइट का और फैन।
और पिंक।
देखना बड़ी इंटरेस्टिंग चीज है।
Is screen visual?
या
Please tell me, is screen visual?
या विजिबल। सेकंड
yes,
स्लाइड
visible.
15, सेकंड स्लाइड 15 on potency 3.
No. See, second slide.
या सी सेकंड स्लाइड 15 on potency 3.
Mhm.
क्या ही करने का?
Previously,
हाँ, रिसर्च करो।
2 things were considered:
सब बंद करो।
nature of
और बंद हो
evacuation
गया।
and
हाँ,
सर आपका माइक ऑन रह गया सिंगल सर।
है भैया? ओके, सॉरी।
माइक आपका
Hmm. Previously, two things are given importance. One is pathological report, another is nature of evacuation. But at present, the nature of sleep also given importance, because in case of autistic baby and others abnormal cases, we have to know regarding their sleep. In case of abnormal baby like autistic baby, they are very disturbed sleep. When treatment will be started fruitfully, the duration of sleep will increase day by day, day by day. And then the brain, the action of the brain will improve a lot. So sleep here is having great importance for evaluation of treatment. The medicine has produced better or expected result should be used 5 potencies in different rounds. But when a case of type 3A, the case belongs to type 3A category, during their treatment, if it is seen after different round, the same that very 65 doses of a certain medicine is giving very good result. One thing I have not shared with you that after seminar, I have started one new idea. I am applying one new idea, that is, if it is possible, patient should write down everyday's remark. If patient is very little one, then parents will keep all the information day to day. Then you will understand, the physician will understand after which medicine, after which potency patient was better regarding sleep, regarding evacuation. So, for every patient, including you, have to write down the remarks after single potency. Today, suppose today you have given 200 potency of a medicine, of one medicine. Next day, you have to write down, or you have to take the report from the parents regarding sleep and also evacuation, and also regarding also for the temperament, change of temperament, what type of obstinate the patient was, what type of raise the patient had, and after treatment, what is the change. Then you will understand how you have to proceed, with which medicine, with which cycle, with which potency, which medicine, of which cycle. But not in the beginning. It is very fruitful, this idea will be fruitful when you will treat the old case. So this thing, you have to mind it, this is the new idea, and you have to use this one. It will be better both the patient and also for the physician. Depending on according to the demand of the situation, when no more improvement will be observed with 5 potencies, next higher potencies should be used, following previous treatment protocol, that is, every day next higher potency, following real homeopathic principles strictly. One thing is very common. After certain higher potency of this medicine, say after 0/42, there is aggravation of suffering. 203 potency of that medicine should be administered immediately. And this idea, you can remember well, I have told you many more times. After any higher potency, if there is aggravation, if there is worse condition, to solve immediately, you have to use single dose of 200 C potency. And problem will be solved instantly. Next, 0/3, 0/2, 0/1 may yield expected result. Otherwise, after 200 C, you have to start 500. This thing you should understand clearly. When you will go from 200 to 500, this thing, if you do not understand, it will be very difficult. If you understand, it will be easier. But in one way, I want to tell you this one. When from 200 you will go 500. Actually, what happened? After 200, if there is little more worse condition, you have to go 0/3. If it is sin, CM, patient was better. After 200, patient is not that type of better. But there is no scope for using 0/3 because you have seen, you have tried with 0/3, but no fruitful result. Then only one option is there. After 200, if you use 500, it will give instant relief. Again, I am telling, what we do generally. After CM, we use 200. When, yes, CM has given fruitful result, but not satisfactory, according to the satisfaction. So you will go to the 200. And you will try. Yes, after 200, it is not such type of betterment is there, observed is there. So then you will go 0/15. I have told you. But if you see, after 0/15, the condition is not so good. CM was better, but not according to expectation. After 200, it is little better, more better, far better. Then you have to go next higher potency. Then you have tried with 0/15. But after 0/15, yes, no more good result. That means only one option is there. After 200, you have to go 500. This part is very important. When you will not get good result with CM, you will not get expected result from 200. You will not get expected result from 0/15. You will not get satisfactory result from 0/3. Then only one option is there. Then you will tell, sir, how I can use different potency? Why patient will tolerate my experience? Yes, one thing. You may do it. You are very right. Patient will not give sufficient time for using different potencies. In that case, yes, after 500, you will get excellent result. But after 0/15, it will not give you the worst result. In little better it will be. And in this case, 0/3 will not give any change. So only one potency will give you pain. will give you pain in this regard that you have to use it. But in real homeopathy, you are very well known that with few minutes we can try it. You can give it one potency and tell your patient, please wait for 30 minutes. And that very 30 minutes will give you in which way, with which potency you have to proceed. So, it is not time consuming phenomenon. And patient will not be irritated, will not irritate with you. Rather, the patient will feel, yes, my physician is trying his her level best to make me free from suffering. So this is the new one, how you can take decision for using 500. And after 500, 1M, then 10M, then 50M, then CM, then 0.50, like that, you may proceed. Up to 0.60 should be administered according to the demand of the situation. That is better pathological report, and also nature of evacuation is better. And not visual report or evacuation, everything will be better. The sleep, the temperament, everything will be better. So one item is better, then all 2-3 items must be better. I do not want to proceed more. I want to start this slide in next Sunday, but next Sunday is a puja. So after that, I will start from this slide. So please bear with me and let me say good night. As it is not so easy, one thing I want to tell you in Bengali, that what যা আমি এখন পর্যন্ত বলেছি ইংলিশে তাকে ব্রিফ করলে দাঁড়ায় এই, পেশেন্টের অবস্থা বুঝে প্রসিড করতে হবে। আমি বলতে পারি না তুমি এরপরে এই দেবে, তুমি ডিসিশন নিতে পারো না এরপরে এই দেবো। ডিসিশন একজন নিতে পারে, সে হলো সিস্টেম অফ দ্য ভিকটিম। The system of the victim may tell you very clearly what should you do, how you have to proceed, and then only you can take right decision. You should not consider my instruction as because there are different patients, there are different power of tolerance, there are different susceptibility. So you have to take decision instantly. That is why you have to know all this. Like this, you are in the battlefield. তুমি যুদ্ধক্ষেত্রে আছো, you are in the battlefield. You are having different weapons like pistol, rifle, machine gun, cannon, everything, all the different weapons are with you. Then, if you know the procedure for using them, then you will proceed with certain weapon. But you are having pistol, someone will kill you with rifle. If you are with rifle, machine gun, cannon, another will kill you with pistol. So you have to prepare yourself with different weapon, like different procedures, different procedure of administration. So this is up to today. And we will meet after puja. Now, pre-puja wish I want to tell you. And for those who are very new in this class, I want to tell you, if you want to know clearly this idea is little easier for my old students, but when you are new one, so for knowing this new thing easily, so you have to get yourself admitted in this student in uh, online class. Then you will understand everything easily. So up to today, and we will meet after that. So happy puja with all of you, and let me say good night.